There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, what is the highest blood pressure a human can have? What symptoms would a person experience? Answer by J.T. William Wiggins. Very high blood pressures are usually associated with brain hemorrhages. The highest blood pressure I have come across is 240 systolic, 200 diastolic. This patient had a brain hemorrhage. When blood pressure increases, one starts to feel buzzing in the ears, frontal or occipital headaches, dizziness. If no antihypertensive treatment is given, then a hemorrhage can happen. The patient can manifest this in a number of ways. They may lose sensation and ability to move parts of their body, generally it is one vertical half, lose the ability to communicate. Some patients lose consciousness abruptly, while others briskly lose consciousness. Even convulsions can happen due to the toxic effects of blood on brain tissue. Answer by Andy Wright. My own record is 340/. I was in critical care with idiopathic multiple organ failure. I had heart failure, kidney failure, pneumonia, bronchitis and a pulmonary edema. Additionally, I also had some problems with my pancreas. It was getting to the end of the year. I teach maths to adults, and there is a contract. You will think that all the learners get a certain number of guided learning hours, and since it is only a small college, cover is hard to come by. Anyway, I probably worked for longer than I should have, and only went to see somebody when I was unable to lie down without my lungs filling up. I had been in critical care for a day or two, and was on a ventilator, with my family around me. I should have been out of it with all the drugs in me, but I had been vaguely aware of something going on, and opened my eyes. Don't ask me what I thought I saw, very trippy, but I had been told I was very keen to communicate. I had an arterial line giving a continuous BP reading, and apparently when the consultant saw it was, he panicked a little, and pumped some more drugs in me to calm me down. At the time, I was given a 5% chance of survival, and if I did come home, I probably would be different. Allusion to brain damage probably. I survived, obviously, and was back to work in time for the new academic year. I had a stent in one of my renal arteries and 2 in my heart. I was on dialysis for a couple of years as I was left with less than 5% kidney function. Last summer, I had a kidney transplant, and I am pleased to report, I'm feeling better than I have done for years. Also, miraculously, apart from the 2 weeks I lost when the incident first happened, I have only had 1 day off sick in the past 4 years. I am on immunosuppressants and am apparently very susceptible to anything going. I laugh inside when I see my class numbers plummet due to winter flu. They are adults, so they may need to miss class looking after a sick child, while this year so far, my attendance is 100%. I guess I am very lucky to have been born with such a strong constitution. I am totally stubborn and nobody can get me to change my mind once it is set. In intensive care, I knew I was in some sort of struggle, didn't know what, but I guess I am mentally pretty strong, got into a massive stubborn streak and was not going to die. I was probably in that mindset when my BP went really high. So, no stroke, no hemorrhaging, but I know life is too short to worry about stuff, so I'm pretty chill. The doctors still don't know what caused all this.